Hi everyone, we are the Group 8 from BSSW-2B with the member Hasmin Sindito, Jonapi Solomon, Antoinette Aguilar, and Abigail Wagas. For today's video, we are going to discuss and present the topic about development of key messages and referral system development and networking or advocacy.
So before we proceed to the discussion, here are some of the learning outcomes. So the first one is the listener are able to identify what is key messages and referral system, able to identify the examples of key messages, able to identify the significance of development of key messages, and able to identify the applicability on the phenomenon or practice we have been in local. So when we say key messages, it is the main point of information you want your audience to hear, understand, and remember. So they are bite-sized summations that articulate what you do it on, and how you are different and what value you bring to stakeholders. Key messages are important because without communications, key messages cannot be delivered. So that's why communication is important in social work practice, because social work professions deals with both simple and complex problems troubling the welfare and well-being of people. So it must need to take a great deal of communication when understanding their problems. A referral system is a mechanism that enables a patient's health need to be comprehensively managed using resources beyond those available at the location they access care from, be it in a community unit, dispensary, health centre, or a higher level health facility. So, ito ay isang proseso ng pagre-refer ng mga kliyente sa ibang organisasyon or tagapagbigay ng serbisyo para sa layunin ng pagtanggap ng isang serbisyo o mga serbisyo na hindi na ibibigay ng nagre-refer na organisasyon na kinakailangan ng kliyente. Key messages must be concise, active, positive, short, and specific.
Key messages clarify meaning and provide the takeaway headlines of the issue you want to communicate. Key messages are important because they serve at the foundation of an organization's branding and marketing efforts and should be reflected in all communications. The significant social work practice based in the key messages and referral system development networking advocacy, the primary mission of the social work profession is to enhance human well-being and help meet basic and complex needs of all people, with a particular focus on those who are vulnerable, oppressed, and living in poverty, and teaching people about resources and how to develop particular skills such as the caring discipline of children and effective communication. The key importance of a referral system is that it ensures that all citizens have access to the highest possible standard of health, irrespective of where they access care in the health system. Movement of the actual patient who is seeking an appropriate level of care at which their health needs are the best addressed.
The applicability of key messages on the phenomenon or practices we have here in local. So the key messages and referral system is applicable to social work practice in the local community, as it is what social work used to intervene in the event, problems, and situation of the individual's family, group, and in the community. For example, in developing services and programs for people, we need to use key messages so that we can communicate to them what we aim and what to provide for them. It is applicable in local community like here because it is basic and mainly used by social work to meet the needs of the people and community, and for people to understand the practice or role of the workers. In referral system, it is applicable here in our local, but it is tried not to be applicable to our local community because it is one of the reasons why intervention with client is prolonged, and it is also one of the reason that the situation has become conflict. For example, similar to hospital, services and proper knowledge and equipment are need to meet the needs of the people when it comes to health. Due to lack of equipment in our dispensary, clients need another dispensary that is complete and proper for them.
Example of K messages. Number 1, tell great stories. Sharing stories is a great way to connect with people. In hearing a story, you may relate to another person and identify with their situation. Beyond being a fun and rewarding experience for you, your story can help others by showing them that they are not alone. Treatment works and recovery is possible. Number 2, deepen engagement. Build trust, be responsive, and build authentic connections. Number 3, grow our audience. Message should always be tailored to the target audience, level of understanding and awareness. Consider also cultural and political feelings and sensitiveness. It is important to connect to your audience values and political views. Good message sometimes require research. Try to learn how can you best influence each of your audience. Each message should take into account the interest and knowledge of the people receiving message. Number 4, cultivate a community of practice. Community of practice are dynamic social structures that require cultivation so that can emerge and grow. Organization can sponsor communities of practice, and through a series of steps, individuals on design a community environment, foster the formalization of the community, and plan activities to help grow and sustain the community. Number 5, plan your campaign. Decide in advance what your key message are going to be. Choose a few messages that you are familiar or comfortable with and stick to them. Once you have developed your message, practice what you are going to say word for word. Number 6, create awareness. Awareness raising is a process that seeks to inform and educate people about a topic or issue with the intention of influencing their attitudes, behaviors, and beliefs towards the achievements of a defined purpose or goal. It can mobilize the power of public opinion in support of an issue and thereby influence the political will of decision makers. Number 7, generate engagement. First, analyze your engagement. Select your strategy, know your audience, create and share valuable content, and stay topical. Number 8, encourage action. Your message should capture the essence of what you are trying to say to a target audience. It should also give the target audience a clear choice of actions and suggest the consequences of those actions. Your message should be clear, whether verbal or in writing. It should also suggest what will happen if your audience takes no action or chooses a different policy option. The goal is for your message to explain why your idea is best such.
So here are some of the examples of referral system. Number 1, the decision is made. Consideration is given to the patient's medical, emotional, cultural, and socio-economic background. Selection of appropriate specialty and appropriate physician in the field. Preparation for both the patient and the family for consultation. preparation of the consultant referral process, and the consultant provides feedback to the family physician.